We're going to talk about high-risk postpartum. And again, I'm going to do this kind of quickly because you've gone over a lot of these things. I just want to highlight key points. So one of the first things we worry about is postpartum hemorrhage. I think we've talked about this a lot, but it's one of the major leading causes of maternal mortality and morbidity in the United States. And is it because we use Pitocin too much and we just tire those uteruses out, and so then postpartumly they aren't reacting to the Pitocin? All their receptors are saturated, so the uterus won't respond to Pitocin. There's some theories in that. It's hard to say, but in the first 24 hours, we're looking at a blood loss of 1,000 milliliters or greater. And then people can actually have a postpartum hemorrhage late. And so that's why and that's when you're seeing, I talked about in that first video where you're seeing you can have retained placenta that for whatever reason wasn't caught. So that's why discharge instructions are so important, so they know how to look for them. One pad in 15 minutes, that is a sign of a postpartum hemorrhage. That is not great. You can also have the steady trickle or ooze, and that can be because you have a lacerated cervix or you have a kind of dribble of blood that doesn't stop. Basically, the way lochia works is you massage the uterus, you get a little gush, and then it kind of stops, and then it collects again, and you get a gush. A steady trickle oozing, that can be signs of cervical lacerations, which can actually lead to a postpartum hemorrhage. A little bit of a different cause. This isn't being caused by a uterus that is boggy and from a placental site with all those vessels open, but same idea, becoming hypovolemic, just like I've talked about like a vaginal wall hematoma can cause that. We've talked all about this, things that you're going to look for. These moms are going to get IV fluids, right? We're going to give some LR. We're going to try to expand those fluids. We're going to go ahead and give her Pitocin, IV Pitocin, to try to clamp that uterus down. We may give Hemabate, Methergin, Cytotec. Those are all 3 different types of drugs that are used. And the 2 things to remember: Hemabate cannot be used for someone who has asthma, and Methergin cannot be used in someone who has preeclampsia or high blood pressure. So I want you to keep that in mind. We do not use Methergin in high blood pressure, Hemabate in asthma. And I mean, this is silly. The way I remember it is Hemabate, histamine, asthma, and histamine can cause asthma and allergic reactions. So H's, that's the only way I've ever been able to remember it. But they ask those questions a lot about Hemabate and Methergin and which moms you can't use it on. Every hospital now is following postpartum hemorrhage protocols that are mandated by the state of Illinois, and you have to have these drugs regularly available, and there's a logarithm. They can even go in and do what's called a Bakri balloon, where they put a balloon in the uterus that they open up, and that balloon tamponades off those open blood vessels. They could, worst case scenario, you're going in for hysterectomy. Sometimes they can go in and actually ligate off some of those major blood vessels to try to stop that too. So here shows you a contracted uterus. So you have this blood that then comes out, and then you have the blood that comes out. And here it's boggy, and you can see this part of the uterus where the placental site just keeps pouring out more blood. And really, that's why there is this big push to quantitative blood loss versus estimated blood loss. And so most hospitals are now weighing chucks, weighing pads, and really trying to quantitate. More than 500 cc's in a vaginal delivery, more than 1,000 in a C-section is considered a postpartum hemorrhage. And so as someone who has a big baby, hydramnios or polyhydramnios, which is large amniotic fluids, anything that might distend the uterus, multiple gestation. So think anything that might cause over distension of the uterus beyond sort of normal pregnancy is going to put those muscles stretched and keep it possibly from clamping down. Someone who's had a lot of babies, the more babies you have, the less, that's a grand multip is greater than 5. That's the less that uterus, it's just tired. The uterus just gets tired and doesn't clamp down as much. If you've had a really fast delivery, a precipitous delivery can actually cause tears. It's someone who just flies through delivery, you have to be careful about vaginal and cervical tears that can often cause. Someone who's labored a really long time, again, the uterus gets tired and may not clamp down, or they've been given a lot of Pitocin during delivery, and a lot of those receptors for oxytocin and Pitocin are already saturated, and so it's not having the same effect postpartum. Forceps or vacuum extractor, what we're worried about that is more lacerations on the inside. And remember, lacerations, cervical tears, a boggy uterus can all lead to postpartum hemorrhage, because postpartum hemorrhage is just excessive bleeding after delivery, so there can be other things that cause it. Sometimes with a cesarean birth and the manual removal of the placenta, it just causes issues. Uterine inversion is a labor and delivery emergency where the uterus can actually flip the other way. So these are the different drugs we're talking about. So drugs that can cause postpartum hemorrhage. So why isn't it weird that oxytocin, Pitocin can cause postpartum hemorrhage when we use it to treat it? But it can cause it because it just can make that uterus saturated out and really tired. Any kind of magnesium sulfate or tocolytic that you might use, Indocin, labetalol sometimes uses a tocolytic, something that might cause the uterus to try to relax is then going to cause problems postpartum, right? If we're giving something to make the uterus relax, like magnesium sulfate, whether magnesium sulfate is being used for neuroprotection or a tocolytic to get steroids on board or for preeclampsia. So it's not being used as a tocolytic, it's being used as a CNS depressant. It's still having the same effect on the muscles of the uterus. And if that's happening postpartum, we got to really watch those moms, because now we're trying to, we're sort of two forces against each other. Same with prostaglandins. Prostaglandins are gels and things that can be used to sort of irritate the cervix and cause contractions, and just anything that can cause contractions can then kind of tire the uterus out. So we talk about an infection. Anyone who has choreo, those moms that are at risk for postpartum hemorrhage because the muscle is just tired and irritated and infected and not working right. If you've had a previous postpartum hemorrhage or uterine surgery, you could have a scar. If you have DIC or any kind of clotting disorder, of course you could have a postpartum hemorrhage. If you have a fibroid, some women who are pregnant will deliver with fibroids, and we're always concerned about those moms hemorrhaging because the fibroids, so the sort of benign mass inside the uterus, keeps the uterus from clamping down the way it's supposed to. General anesthesia, the same thing. It just causes massive relaxation, basically. So what are we most concerned about? Perineal trauma as well. I talked about this, how lacerations, hematomas, and things like that. So that's why the doctor or midwife takes a really good look after inside the vagina and at the cervix and really tries to see if there's lacerations that need repair. And so if you are going to lose a lot of blood, you are going to go into hypovolemic shock. And actually, because of all the blood that's added, you're not necessarily going to see shock until you're losing between 1,500 and 2,000. And so that's why we really need to start intervening before we see the hypovolemic shock. So identifying predisposing factors. So now anytime a mom is known to have those predisposing factors, they're put on a postpartum hemorrhage protocol, and the hemorrhage cart is in the hallway, and they have the meds drawn up and ready to go, and they have a Bacri balloon in the room. They're checking the bladder with a Foley. They're not waiting to see if she goes into shock, because by then moms have lost a lot of blood, because remember, they already have an increase in blood volume when they're pregnant. So there's a little bit of a buffer there. There's fundal massage. Sometimes doctors will actually do this where they put their entire fist up to try to really massage it up against it. As you can tell, this is pretty uncomfortable, right, for a mom, but hopefully if they have an epidural, if not, they're going to go ahead and be giving her medications. In an involution, if this uterus actually became involuted, they would actually stick their hand to put the uterus back up. And those moms are on antibiotics for a couple days. Here's a little bit more of, that's an emergency when it actually flips. Subinvolution is just when it's not going down like we expect, and that's when we're going to go back in and look for retained placenta and things like that. So you're going to foul odor, fever, abdominal tenderness, continuing to pass clots, saturating more than a pad an hour. Those would all be reasons when you go home to call the doctor. We know because of the increased clotting factors that Mother Nature loves you and gives you while you're pregnant. Sadly, it also puts you at risk for throwing clots, okay, or a thrombophlebitis or an increased risk for phlebitis. And then they can have an actual emboli that can either be a thrombus or actually amniotic fluid, and that's when we talked about like amniotic fluid embolus. And so obviously when this happens, it's super scary. They can go into DIC and die. And so it's something you want to be looking out for sure. Superficial is going to cause varicose veins, those kinds of things. And then deep vein, often people actually often don't have symptoms. So that's why it's important they know if they feel short of breath all of a sudden. Any of those kinds of things we want to make sure patients are aware of. You guys know what puts you at increased risk for that. So again, I'll let you look through that. increased priority, that's meaning having a lot of babies. More of these, we'll let you look through that. Obviously, a PE is one of the most severe complications of a DVT, and we see that leading towards mortality. And we're also kind of calling this part of that anaphylactoid syndrome or amniotic fluid embolus. We're not really sure what happens. Does the body go into this almost like a like immune-mediated response, and it's anaphylactic shock kind of too. But it is very serious when that happens, and that's when you're calling a code and the whole team is involved, and that's incredibly scary. One of the biggest things that can happen to a mom postpartum is infection. So endometritis, it's no longer choreo, the chorion's gone. So now we're looking at endometritis, which is the lining of the uterus can be infected. You could have a wound from a C-section or a perineal tear that gets infected. You could have a UTI. Septic pelvic thrombophlebitis, that sounds terrible, right? So someone actually gets a thrombus in their pelvic. You have a lot of pelvic blood vessels, and so someone can get an infection caused by that. So if they're having a lot of pelvic pain and they have a fever, that's something you're going to look into. Mastitis, women are educated about what to look for when they have mastitis, and so they can get mastitis from cracking of the nipples or any tears that get in the nipples, and that's why it's really important that we help babies latch on appropriately, that we teach moms to let their breasts air dry in between, that we'll have them even squeeze colostrum and rub that on their nipples. We have them use nursing pads and change them often because you don't want moist nursing pads sitting there that can macerate the tissue. Some women will have their milk comes flooding in, and they will have engorgement, and we treat engorgement with ice, not water. You treat engorgement with ice. You could do hot water to just soften up a little bit before you breastfeed because it's hard to breastfeed on like a bowling ball, but ice is what helps with engorgement. With mastitis, it's typically just on one side. They can feel it in their lymph nodes often. They will get a fever. These moms need to be treated with antibiotics. They can get very sick. You guys can go through and read this. You guys understand. Remember, uterine subinvolution is when the uterus just is still palpable, right? Remember, by 11 to 14 days, it should be going down. I'm just going to end. We talked about postpartum mood disorders. Depression, they call postpartum depression, which actually the more current term is perinatal mood disorder. And one of the things with perinatal mood disorders is that sometimes it presents more as anxiety than depression. And this lasts past that 2 weeks. It's bigger than baby blues. A lot of these moms, as you guys know, this is one of my passions and what I spend a lot of time with moms running a support group. But a lot of these moms have difficulty eating, difficulty sleeping. They have intrusive thoughts. They are hypervigilant about their babies to the point that they will often start to imagine, like, for example, I'm looking out the window right now. I'm down at my mom's apartment. I'm looking out the window at the city, and some of the intrusive types thoughts people would have would be like, what if I held my baby and threw my baby out the window? And it's not that they want to throw their baby out the window. It's that just the idea that could happen. Or what if that ceiling fan were to drop on my baby? Or what if those knives in the kitchen were somehow to stab my baby? And we talk a lot about intrusive thoughts. It is super common. It's one of the biggest secrets of postpartum, are intrusive thoughts, because it's disturbing. And if you tell someone you have intrusive thoughts, people can be freaked out and think it means you want to hurt your baby. And how I've seen it described is like the mama bear instinct gone haywire. So when we are going about our daily life, we are constantly scanning for things that could be dangerous, right? We know to not cross the street if a car's coming. We know not to touch a hot stove. We know to be careful if we are walking on an uneven sidewalk. And these are things that we unconsciously do all the time to keep ourselves safe. Then you have a baby, and a lot of those unconscious factors that you have kind of move into the conscious state. So then you're having really disturbing thoughts because you're consciously thinking about every bad thing that can happen. And then you're starting to think, what the hell is wrong with me? And so to me, I see a lot of people with intrusive thoughts. You see people who have a history of OCD or anxiety have it. It responds really well to medication, or we'll have moms wear a rubber band and snap it every time they have an intrusive thought. And it's really just brain training. That is different than postpartum psychosis. Postpartum psychosis is they don't have enough wherewithal to even know that they're having these intrusive thoughts. Postpartum psychosis is 1%. It's people who have a really lost touch with reality. it is a medical emergency. They need to be brought to the emergency room. They're at risk for not only harming themselves, but possibly their baby. And they're hearing voices. My friend had postpartum psychosis, one of the only people I've ever known who's had it. And it appeared, they don't know why some people get this, but it's so rare. But she said she was in the hospital and she kept hearing voices. And she knew that was weird. And so like she had the wherewithal to know that was weird, but she couldn't stop it. Like she kept hearing voices, and she was admitted for a while, but is fine now. But that's considered a medical emergency, and people hearing voices, seeing things, hallucinations, delusions of grandeur, things like that. People with bipolar are at great risk for postpartum depression. So these are things you can look at. Certainly, people can be suicidal if they have postpartum depression, so you'd always want to assess for that. I kind of just talked about anxiety disorders. So that's it for high-risk postpartum. Let's see. Oh my gosh. Why can I never do this right? Oh my gosh, what is wrong?